My name is Mondrae, student, ADN transition student. I'm about to be performing the Foley catheter. First, I'll check physician's orders to make sure I have an order to do this procedure. I will check the patient marked for allergies to latex, iodine, and betadine. After I do that, I'm going to gather my supplies, Foley catheter, goggles, extra pair of sterile gloves, wash my hands, go to the patient room, identify the patient with 2 patient identifiers, the name and date of birth. After I do that, I'm gonna check her armband for any allergies. After I do that, then I'm gonna introduce myself, and since I'm a male, I'm gonna ask, is she comfortable with me doing this procedure, because we want to make sure no conflict with her spiritual or cultural beliefs. Then I will gather supplies. No, I'm provide privacy. Side rails up, physically lock the bed, and put my bed at working height. Now that I'm in the patient room, I'm going to provide period care. And I'll put my goggles on, put gloves on, and gather my supplies after I provide period care, and wash my hands first before I gather my supplies. Okay, the patient is in dorsal reclined position. I provide period care. I already washed my hands. I have on clean gloves. So now we're going to remove. We're going to remove the bag. I can use this as a trash can. Trash can. Okay, this is it. I'm trying to maintain sterility as much as possible. This is my patient right here. Okay, I'm not going to turn my back on sterile anytime. Okay, I'm first turn the catheter kit. Open the catheter kit away from me, and I'll keep when I'm sterile, I'll keep my hands above my waist level. So okay, I'm going away from me first. Okay, now the sides. Again, careful not to break sterility. Okay, now I have my sterile gloves. So I'm going to get my sterile gloves, and I don't have a bedside table for my sterile gloves, but I would do my sterile gloves on a bedside table on a clean surface. So I'm doing it right here. Never turn my back on the patient, or it's my sterile field. So now I'm about to put on my sterile gloves. Okay, only touching the outer 1-inch border short right now. I'm gonna fold the top away from me, and then the bottom this way. Then I'm gonna touch the very middle of the the side flaps. 1-inch borders. Okay. Now my sterile field is open. I can use my thumb and 2 pincher fingers to pinch the gloves. I'm doing my right hand first because that's my dominant hand, and I'm gonna slide my hand in. Okay. Maintain stability as much as possible. Okay. Now I'm going to use these 2 fingers to cuff under the cup, to catch under the cuffs of the second glove, my left hand glove. Remain sterile. Put my hand in. Okay. And now I'm going to square off my sterile field, touching the inside, okay, touching the inside. All right, my drape